Why do you think personalization is important right now in healthcare? And then what trends have you observed in this space in last few years? It would be great, Shah, if we could start with you.
Sure, thank you. Let's review a little bit what personalized medicine is, right? So, using things like genetic testing, looking for biomarkers, using big data, artificial intelligence, bringing all those types of things together to personalize a treatment plan for a patient or a particular condition. So, that's how sort of my definition of personalized medicine. In that, I think we are seeing quite a bit of traction as in some areas, specifically cancer related, right? So there is already, whether it is breast cancer or a number of lung, a number of other categories, using genetic testing, people are starting to identify areas that allow physicians to then personalize treatment for that particular condition. And it is very successful. It's, I think, very broadly and widely adopted or being adopted now. There are other areas too, such as chronic disease management, type 2 diabetes come to mind, which is sort of that particular area or chronic disease management is perhaps in a little bit of earlier in the life cycle. There are certainly physicians and providers working on those types of treatments for patients, but on the regulatory side, there is not as much clarity in terms of how those should be done. There is some concern about data privacy and those types of things as well. And then insurance providers don't seem to really have sort of well-defined plans, if you will, in terms of how they would pay for chronic disease management or personalized medicine and chronic disease management. So a little bit of a mixed bag, but oncology and cancer seems to be the area where it is being most widely used at this time.